Hi there.
Hello.
Welcome to the office. How are you doing today?
I'm okay. I just have been feeling these tingles and numbness of my hands and my feet. So I wanted to come in and, for you to take a look and see why that is.
Yeah, I'm glad you came in. Now, tell me more about these tingles and numbness in your hands and feet.
Yeah, so before I would just be a few times a week where I would feel just bursts of numbness and tingleness in my hands and feet, but it would be 30 minutes to an hour long. But the past week I've been feeling it like 2 to 3 times a day.
Wow.
So I don't think that's good.
Yeah. Is there anything that brought this on? I know oftentimes with numbness and tingling, it can be brought on by, let's say, if you're in a specific position of your body, or you think of anything that might have brought it on?
Maybe like me working on my desk, but I don't know.
Yeah. What is your job?
I work in HR.
Okay. And how long have you had this job?
Over 2 years now.
Over 2 years, okay. But this numbness and tingling has only started, you said, a few months ago-ish? Okay. But this past week has been really bad. Okay. I hear you. And when it comes on, you said 2 to 3 times a day. How often does it last? Like, how long does it last?
Same, where it's 30 minutes to an hour.
Okay. And can you point to exactly where you experience it in your hands?
It's like here, and then sometimes I would feel it go up my arm.
Go up your forearms? Okay, and up to the elbow? Okay. And what about your feet?
Yeah, like around here, and then sometimes a little bit up here.
Okay. Some radiation to the forearm and to lower leg. Okay. All right. Can you describe to me the sensation of numbness and tingling that you feel?
It's kind of like pins and needles.
Pins and needles? Yeah.
That I feel. It's just very uncomfortable.
Yeah. So I want you to rate the intensity from 1 to 10, 10 being the most uncomfortable sensation you've felt. How would you rate it?
When it's really bad, it's a 7 out of 10.
Okay. And normally?
Like a 4 or 5.
4 to 5 out of 10. Okay. So have you ever felt this pins and needle sensation prior to the past few months?
Here and then, where I realized that if I'm sitting for too long, I would feel it, but it wasn't as frequent as now.
And how long would it last before?
Like 10 minutes.
Maybe 10 minutes? Okay. So it's unusual for you to have it, going on for up to an hour right now, and especially a few times a day without any known cause. Okay. So have you been feeling any fatigue?
I have been feeling burnt out, sluggish. And I realized at night I don't really sleep well because of the numbness and tingling that I'm feeling.
How many hours would you say you sleep every night these days?
Like 5.
5 hours, yeah. That really must take a toll on your energy levels. Okay. All right. And have you experienced any muscle weakness recently?
I realized if I'm going up the stairs, my muscles get really weak.
Which muscles?
Afterwards. Which muscles?
Yeah.
My leg muscles.
Your leg muscles? Okay. Legs feel weak going up the stairs. More so than before? Okay. Do you do any exercise lately?
Yeah, I try to do some workouts, but I just get really tired and I can't continue.
I'm sorry to hear that. Have you had any pain other than the numbness sensation? Is there any pain at all anywhere in your body? No pain?
No.
Okay. Okay, so in terms of your cognitive abilities, your brain, have you noticed any changes in your memory, your thinking or learning?
Yeah, I've noticed I'm more forgetful.
Okay.
Yeah, just like simple things. I feel like I just can't remember.
And what kinds of things?
Like I'll tell myself that I have to buy milk and then go to the store and I forget why I'm there.
And how frequently does that happen?
Not too frequently, but it does happen. I think it's been happening since like a few weeks back.
Okay. Is that concerning for you?
Mm-hmm.
Yeah. How has your mood been lately?
I am kind of irritated because of, and uncomfortable because of the sensations.
Yeah. Okay. Have you had any injuries recently or even before?
No.
Any accidents?
Mm.
Do you drink alcohol?
No.
Do you take recreational drugs? Okay. Do you take any medications?
Mm-hmm. I take one for my heartburn.
Is it esomeprazole by any chance?
Yes.
Okay. How much of that do you take?
When I feel the symptoms, I take 2 packets.
2 packets, so 20 milligrams. How often do you take it?
I take it once a day.
Once a day, okay. Right, and this is for your heartburn. All right. And how is your diet?
Yeah, I've been cutting out red meat because it triggers my heartburn.
Okay.
So I've been eating more plant-based diet.
So, like vegetables, grains, that kind of thing?
Yes.
Okay, beans and whatnot. When did you start this diet?
A year ago.
A year ago? Okay. All right. Okay. I think that's... Do you have any pre-existing medical conditions? No? Okay. All right. Is there anything else you'd like to add?
No, I don't think so.
Any questions you have for me? Okay. So let me go ahead and begin the examination. I'm going to start just by checking your mental status. You appear to be awake and alert, although you do seem a bit tired. So I'm just going to write that down. What day is it today?
January 30th, Monday.
Good. And where are you?
In your office.
Okay. Who am I?
The doctor.
Good. Okay. And so far your language skills have been fluent. You're responsive, so no issues there. Okay. So now let's go ahead and start the cranial nerve exam. Okay, so I don't notice that you have any neurological symptoms that are that pertain to the brain, to the cranial nerves. But I'm just going to do a few. It's kind of routine. Okay, so just bear with me. All right, so I'm just going to take a look at your pupils. So I want you to just look straight at that wall right there. Okay. Let me just see here. Great. Good. Perfect. Let's look on the other side. Good. Perfect. Good. Perfect. Okay. Now I want you to just follow the tip of my otoscope here, okay? Just with your eyes, not with your head. Good. And go a little further out. Is that difficult for you at all? You seem to be doing really well. Okay, down here. Up. Perfect. Great. Okay, so I'm just going to whisper a few words to each ear, and I want you to just repeat back to me, okay? Great. So I'm just going to do that.
Feather.
Okay.
Tree.
Good.
Bench.
Perfect.
Eyebrow.
Okay, great. So no issues with hearing. Okay. Why don't you just open your mouth and say ah?
Ah.
Great. Perfect. You feel his midline and your palate has no problem going up. Okay, I want you to follow a few directions. So I want you to puff out your cheeks like this. Great. I want to just test that actually. Just do it one more time. Good. I want you to do kind of a frown. Good. I want you to raise your eyebrows. I'm just going to test that. Okay. Now I want you to show me your teeth like this. Good. Great. Now I want you to squeeze your eyes as closed. Good. Don't let me open them. Don't let me open them. Perfect. Okay. Okay, facial strength. Good. Perfect. All right. So now we're going to be testing your myotomes, which is basically your muscle strength, and it also correlates with the nerves that are responsible for moving those muscles. So let's start with the top here. So I want you to resist the pressure of my hand as much as you can, okay? Let me know if you're feeling tired at all with any of these movements. I'm going to hold it for 5 seconds each. So I want you to bend your head forward and resist pressure. 1, 2, 3, 4, 5. Good. Now I want you to bend your head back and resist the pressure of my hand. 1, 2, 3, 4, 5. Very good. Now we're going to bend to the side here. 1, 2, 3, 4, 5. Great. Other way. 1, 2, 3, 4, 5. Perfect. Okay, now I want you to shrug your shoulders up and resist the pressure. 1, 2, 3, 4, 5. Perfect. Okay, so now we're going to do one side at a time. I'm going to have you resist the pressure of my hand here, okay? Here, just push right in. Just using your shoulder, kind of like going up like this a bit. 1, 2, 3, 4, 5. Good. Right here. 1, 2, 3, 4, 5. Great. Okay. All right. So now I want you to resist my pressure right down here. 1, 2, 3, 4, 5. Perfect. Test the other side. 1, 2, 3, 4, 5. Great. Okay, so we did that one. Now we're going to do this side. So I want you to resist pressure up here. 1, 2, 3, 4, 5. And here. 1, 2, 3, 4, 5. Now we're going to do extension of the thumb. So I want you to just resist this pressure. 1, 2, 3, 4, 5. Good. Other side. Resist, resist, resist. 1, 2, 3, 4, 5. Great. Now I'm going to be squeezing your fingers in like this. I want you to resist. Taking me. Try to spread your fingers out like that. Good. 1, 2, 3, 4, 5. Great. Other side. 1, 1, 2, 3, 4, 5. Are you feeling any pins and needles right now in your hands at all? Not right now. Okay. And then I'm just going to kind of do this. And I want you to squeeze your fingers together against my hands. Don't let me pull my hand out. 1, 2, 3, 4, 5. Wonderful strength. Let's do that again here. And then, yeah, 1, 2, 3, 4, 5. Perfect. So no issues for the upper body. So let's go ahead and do some more tests on the upper body before we move on to the lower body. So I'm just going to do some deep tendon reflexes. Just move your hair back here. Okay. Really relax as much as you can here. Let's see. Good. Perfect. And then just let yourself, yeah. Good. That's it. Good. And right here. Good. Okay. Let's start with this one. Just relax there. Good. It's a very quick contraction. And then just hang loose. There we go. Perfect. Great. Okay, so your upper body deep tendon reflexes are all 4+. Great. Immediate contractions. Okay. All right. So here I have a cotton ball, and I'm just going to use it to trace your dermatomes, which are basically nerves that are innervating different parts of your skin. So I want you to tell me, with closed eyes, I want you to tell me if you feel the same sensation on both sides or different, okay? All right. Just going to remove this, okay? Same or different?
This feels lighter.
Feels lighter on the side?
Same.
Same? Okay. All right. I'll just go a little bit slower so you can... Same or different?
Same.
Okay. And you were able to feel all those sensations? Okay, good. Now, to the side. Same or different?
Same.
Okay. Okay. And then just same or different?
Same.
Okay, good. Okay, so just dermatome C62. Temperature. So here I have 2 tuning forks, and they each have different temperatures, either warm or cold. So I want you to let me know if you're feeling warm or cold, okay? Just testing your temperature sensation. Okay. So we're just going to just close your eyes, please. Cold. Warm. Cold. Warm. Warm. Yeah. Yeah, the water's not as warm as it used to be. Cold. Warm. 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 Cold. Warm. Warm. Cold. 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 Warm. Okay, great. So this is a clean tool, and I'm going to use it to test your sharp and dull sensation. Okay. Close your eyes. Sharp. Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Okay, great. Let's just turn my hand over. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Okay, good. Okay, so close your eyes and we'll test this arm right here. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Perfect. All right. Okay. So continue to close your eyes, and now I'm going to be testing your position sense. So when I bring your finger up versus down, up versus down, I want you to tell me which way I'm moving, various parts of your body, okay? All right. Down, up, down, up, up, down, up, down, up, 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 down. Okay. Up, up, Close your eyes.
Up, down, up, up, down, up, down, down, up, 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 down, down, up, down, down, up.
Perfect. Okay, so position sense is perfectly intact. Okay, good. So now I'll be testing your vibration. I'm going to have you close your eyes again. Let me know if you feel the vibration or if it feels like something different. And then I want you to tell me when you stop feeling it, okay?
I feel it. Stopped.
Good. Do you feel it?
Stopped.
Good. Do you feel that?
Stopped.
Good.
Stopped.
Do you feel this?
Stopped.
Great.
Stopped.
Close your eyes.
Stopped. 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 Stopped.
Amazing.
Stopped.
Good. Let's move up a little bit and then onto your spine a bit as well. Close your eyes again. You feel that?
Stopped.
Okay. Close your eyes. Do you feel this vibration? Okay.
Stopped.
Good.
Stopped. Stopped.
Good. Okay, I just want you to turn around. So we're just going to test a few of your vertebrae as well, your spinous processes. Do you feel that?
Stopped. 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 Stop.
And just one more down here. Perfect. Okay, you can just lower down your tank top now. Okay. So the next test is called discriminative sensation. There's a few in here, and the first one is Stereognosis. And I'm going to give you a few objects one by one. You let me know with your eyes closed what you feel, what you think it is. Okay, so the first object, go ahead and feel it with your fingers.
This is a screw.
Perfect. What is this?
It's like a circular ring.
Yeah, perfect. What is this?
Cotton ball.
Great. What is this?
Money. Coins.
Perfect. You got it. Okay. So now I'm going to be writing out numbers on your hand first, and then I'm going to move up your arm. And with your eyes closed, let me know what the number is, okay?
3.
Good.
1. 5.
Good.
6.
Okay, let's do your other hand.
Do it again. 7.
Good.
8. 9. 0.
Perfect. Let's do a few more going up the arm.
5.
Good.
0.
It's close.
6.
Great.
2. 1. 9. 7.
Good.
8. 8. 3.
Good.
4. 0.
Close.
6.
Yeah. Awesome. Amazing job. Right. Okay. So now we're going to be testing your coordination. We're going to start with rapid alternating movements. So I want you to do this motion. And faster, faster. Perfect. Okay. Now I want you to take your index finger and tap it to your thumb. And do both sides and tap very quickly. Perfect. Okay. Now I want you to tap your nose and then tap my index finger here. And we're going to go faster. Good. Okay. Perfect. Nice. All right, so let's go ahead and do all of those exams, but on your lower body. And then I'll go ahead and tell you the next steps. Okay? Do you have any questions for me at the moment?
No.
All right. All right, so now that we've completed all of your exams, and I also have your blood work here from 6 months ago from your previous family doctor. It looks like you've got a vitamin B12 deficiency. Were you aware of that? Mm-hmm. So your doctor didn't really tell you about this or any of that? Okay. Well, it does seem quite concerning to me because it is actually quite low. And I imagine this might be the cause of your pins and needles. Based on the exams, I've ruled out some conditions, although I do want to do a little bit more blood work to make sure that I can completely rule out other conditions. But it looks like it might be the B12 deficiency that is causing the pins and needles. Luckily, this is reversible if we give you some B12, and I suspect it's because you've been eating a plant-based diet, and the foods that are the richest source of B12 are often from animals. So this can be meats, and fish, chicken, and even eggs and dairy. But we can give you some injections, some muscular injections of B12 that will help you feel better. And we may also give you a supplement. But before we do that, I just want to do another requisition for blood work. I also want to check your glucose levels, your fasting glucose, insulin, all of that stuff as well. I also want to do a urine test to see if there's anything there that I've missed. But the good thing is, yeah, with vitamin B12 deficiency, it is reversible. So I'm not too concerned for you. Do you have any questions for me at all?
No, thank you so much.
Hey, no problem at all. Okay, we will see you soon, and my receptionist will take care of all the requisition work, and we will see you again soon.
All right, thank you so much.
Take care.
Bye.
Bye now.